Avec Clic Santé, c'était facile de prendre rendez-vous. Le centre de vaccination était très efficace et rapide. Ça a été une réussite. Prochain défi, redresser le réseau de la santé. On accélère les chirurgies.
All right, that's part of a video posted by the CAQ. It starts with Premier Legault. That, of course, was Health Minister Christian Dubé. Basically trying to pat themselves on the back for the wonderful job they're doing in the healthcare system, which seems an odd thing to be doing. But then again, they are, of course, suffering in the polls. Maybe they thought this would be a good way to try to get some attention. I don't know. Reaction has not exactly been overwhelmingly positive. Aaron Derfel, award-winning health reporter at the Montreal Gazette, posted about this. Aaron, I love the way you did this, and thank you for being here, by the way. It's kind of like, okay, here's what they claim in the video. Here's the reality, true, false, or misleading. So, first of all, just overall, what did you think of this idea of them posting this to begin with?
Well, I think that they're trailing, in third place right now, and this video is set to this music that's mournful at the start, and then it becomes quite hopeful. And I think that the CAQ is aware that they have to improve their image. So what they're doing here is it's spin. It's propaganda, nothing more than that. 7 claims that they make in about 2 minutes. And I think 2 turned out to be true. The others were misleading. I found that was surprising that it was that inaccurate. And for example...
Well, okay, well, let me go through them so we can go through a couple of these and you can explain what they mean, all right? First claim by the government, they trained thousands of personal support workers in a few months to care for the elderly in nursing homes. True, false, or misleading?
Well, that's misleading because although initially there were 10,000 who signed up, a third quit before the training was over. And then, I don't know if it was last year or the year before, Christian Dubé, the health minister, said that they're still short 11,000. Actually, it got worse, 11,000 personal support workers. So that, to me, is misleading.
Okay. Claim number 2, it's easy to schedule I'm sorry, I'm trying not to laugh. It's easy to schedule a medical appointment with the government's online portal.
Well, that's misleading. So at first glance, yes, you just click a few things. But then, I tried it out yesterday, and I got this message saying I have to contact my clinic for health information. I'm not registered with the clinic. So that was absurd. The Liberal health critic tried as well, wasn't able to get anywhere. And even when you register with a clinic, it's not automatic that you'll get an appointment either. So that's misleading.
Okay, again, this seems to me Andre Fortin actually did this in front of the health minister, right? Went through the whole process and could not get an appointment, and then tried again and could not get an appointment. So when they say easy to use, yeah, it's not that hard to figure out how to use it, but it doesn't necessarily get you anywhere.
Absolutely.
Okay.
Yeah.
Claim number 3, the volume of surgeries here is, quote, accelerating. What does that mean?
Well, they are, during the deadly stage of the pandemic, they ramped down surgeries to protect hospitals, although the virus was rampaging through nursing homes. And now you have this big backlog. So they have ramped back up surgeries, but we've got a record 163,000 Quebecers who are waiting for surgery, and that doesn't include what I wrote. It was like 1,600 or so people who are waiting for heart surgery. And what's really, really astonishing is that 58% of the heart patients who are waiting for an operation are waiting beyond the medically acceptable deadline. That to me is shocking.
Okay. Next up, claim. Since the health ministry set up in September 2022 an enhanced version of the Guichet d'accès à la première ligne, the GAP, or what we know in English, emergency room visits have been reduced by 1.5 million.
Yeah, that's really misleading because Christian Dubé is extrapolating, presuming that because people have logged in and called InfoSanté a total of 1.5 million times, this has resulted in 1.5 million fewer ER visits. It doesn't work that way. In fact, the ERs are busier than they've ever been, in part because you have a lot of staff who are burnt out, and the patients who are showing up have more complex medical problems. It's gotten to the point where some of the ERs are not safe, as I've written about. So that's misleading.
All right. So the last one I want to touch on, since 2022, more than 900,000 Quebecers have been registered with a family medicine group.
Yeah, well, at first glance, I guess I was being charitable. I wrote that it's true, although I did get some emails from readers who are saying, yes, it might be true, but then it's another thing to get an appointment. So it's just, it's a different story once you really try to get access to a doctor. So overall, it's not a record to be proud of by any means.
Well, not a record to be proud of when you consider that you can say, yes, 900,000 Quebecers have, but how many are still on that wait list?
Yeah, I mean, there are more than 600,000 Quebecers who are waiting, so it's just not, it doesn't cut it.
Do you want to, yes, we talked about the fact that they're, the polls, they're trailing, things have not gone well. Is that what you think is behind this? Like, I guess my question is, why now for this?
I think it's precisely because they're trailing in the polls. It's one poll after another, and the last poll placed them, I believe, behind the Liberals, and so I think they're running scared, and they have François Legault has a big entourage, of advisors, and I think that's what they're trying to do. They're just trying to spin it. And, this is something he did during the pandemic. Quebec, that was another claim. Quebec has had the highest COVID death rate. And he's saying, well, if you take into account excess mortality, we're actually better than the rest of the country and the rest of the United States. That's a very abstract concept that epidemiologists use. And so, again, it's been my role here is to fact check and to present the accurate context to the readers.
By the way, I do want to point out what you just said. It begins with, this video posted by them begins with this idea of look how well we did during the pandemic, which I found was bizarre. We're talking about something that happened now 3-4 years ago, yet they chose to begin with that.
Yeah, it starts with them saying that, the CAQ government had inherited a horribly run healthcare system from the former Liberal government, which had imposed these cutbacks, these austerity measures. And so, according to Legault's narrative, we started to fix things, and then the pandemic hit. And yet, even despite, this unprecedented crisis, numbers are going, by every metric, we're improving things. Although, as I pointed out, that's just not true.
So just as we wrap up, have you seen anything? You're all over the health situation here in the province. You write about it extensively. Have you seen anything that gives you hope that things are changing for the better?
Well, I think that, Christian Dubé, who's a self-described numbers man, he's posting a lot of this data that hadn't been posted before. So, I just dig into it and drill down. And I think that's good when you start, you've got these metrics so you can assess the situation more accurately. I definitely think there's a will to improve things. But I don't want to give, your listeners a false hope. The situation is dire and it might get worse before it gets better.
Fair enough. All right, Aaron, I thank you so much. I always appreciate it.
My pleasure.
Aaron Derfel of the Montreal Gazette. And if you haven't seen the video, by the way, it's up on Twitter as well. And it's interesting because it is produced. This is not just Christian Dubé and François Legault sitting there going, oh, look how well we've done. As he said, there's some somber music at the beginning when they're talking about the pandemic. And then, as he said as well, hopeful music, if you will, towards the end. So I don't know, just strikes me as very odd to be in the middle of nowhere. In terms of time, to be posting this, talking about how well you've managed the healthcare system when we know there's so many problems. And it's interesting as well, as we're talking about this, right? I get a text from someone saying, yeah, our health system is really, really great. Where's it? It took my 17-year-old who's told by her doctor now she has to find another doctor. There are obviously a lot of doctors leaving the system now as well. So I can't find it, but that's in essence what it says. So there you go. If you want to see it, it's on Twitter. You can find it. Just if you look under the Coalition Avenir Quebec under CAQ, you'll find it there.